What if the AI you already use every day is quietly becoming one of the most powerful health tools ever created and most people haven't even noticed yet? OpenAI has announced a significant push to improve what it calls health intelligence within ChatGPT, and this development deserves far more attention than it's currently receiving. This isn't just a software update. This is a fundamental repositioning of one of the world's most widely used AI systems into a space that directly affects human lives, medical decisions, and the future of healthcare as we know it. So what exactly is OpenAI doing here? The company is actively working to enhance ChatGPT's ability to understand, interpret, and respond to health-related queries with greater accuracy, nuance, and clinical relevance. The goal is to move beyond the generic, disclaimer-heavy responses that have frustrated users in the past, those moments where you ask a straightforward health question and get buried under a wall of "please consult a doctor" language and instead deliver genuinely useful, medically informed guidance. This matters enormously when you consider the scale of ChatGPT's user base. We're talking about hundreds of millions of people globally who are already turning to this platform with sensitive health questions. Questions about symptoms they're embarrassed to ask their doctor about. Questions about medications, mental health, chronic conditions, nutrition, and reproductive health. These conversations are already happening. The question OpenAI is now grappling with is not whether ChatGPT should be a health resource it already is, but rather how to make it a responsible and genuinely effective one. The challenge here is extraordinary in its complexity. Health information is not static. It evolves with new research, varies dramatically between individuals, and carries life-altering consequences when it goes wrong. A model that confidently delivers outdated clinical guidance isn't just unhelpful, it could be dangerous. OpenAI appears to understand this risk deeply, which is why this initiative reportedly involves collaboration with medical professionals and health experts to fine-tune how the model reasons through health-related scenarios. There's also a deeper philosophical question sitting underneath all of this. For decades, access to high-quality medical information has been profoundly unequal. If you're wealthy, educated, and live near major medical centers, you have access to world-class expertise. If you're not, your options are far more limited. An AI system that can genuinely elevate the quality of health conversations, that can help someone in a rural community or a developing nation understand their symptoms, evaluate their options, and advocate for themselves with their doctor, that's not just a product improvement. That's potentially a democratization of health literacy at a scale we've never seen before. But the scrutiny this development will face is equally significant. Regulators, healthcare professionals, and patient advocates will all be watching closely. The line between providing health information and practicing medicine without a license is a legal and ethical minefield. How ChatGPT navigates questions about dosing, diagnosis, or mental health crises will be examined under a microscope. And rightly so. What's particularly fascinating about OpenAI's approach is the implicit acknowledgement that previous guardrails may have been too blunt. The reflexive pivot to see a professional for every health question isn't just unhelpful, it's a missed opportunity to genuinely serve people at their most vulnerable moments. Getting this calibration right, being helpful without being reckless, is arguably the most important design challenge in AI right now. We are watching in real time as artificial intelligence moves from novelty to necessity in healthcare. OpenAI isn't just building a smarter chatbot, it's attempting to redefine what it means to have access to health knowledge in the 21st century. And the question we should all be sitting with tonight is this: are we ready for an AI that knows more about our health than our own doctor does?